Hi, everyone, and welcome to our Health Talk. My name is Alina, and my pronouns are she and her. On behalf of the Patient Education and Engagement Program here at the University Health Network, thank you for watching this session on preventing and managing pressure injuries, working together to protect the integrity of your skin. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. Although we are presenting this health talk in the digital world today, we want to acknowledge and remind ourselves and encourage you to do the same too wherever you are currently located, that we are still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work, learn, and play on this territory. And thank you to those who have submitted questions. The speakers will be speaking to some frequently asked questions throughout their presentation. And now I would like to take a moment to introduce you to the wonderful group of speakers for this session. Chris Stages is a 10-year spinal cord injury survivor. He's been through endless spaces and services of our healthcare system. Advocacy has been a huge part of his recovery, both with UHN and other municipal and provincial agencies. His favorite quote is, "Don't look back, you're not going that way." Catherine Morris is a registered nurse who has achieved a master's degree in adult education. She works at UHN Toronto Western Hospital as a clinical nurse specialist in wound care, consulting and caring for patients with complex wounds, and engaging in quality improvement and research related to pressure injury prevention. And Joshua Moraljo is a registered nurse who has developed a passion for wound and ostomy care. He is presently the clinical nurse specialist at TRI Bickle Center, serving our complex continuing care patient population. His passion for change and advances in care has led him to be involved in provincial guideline development and expert working panel groups. Tess D is a registered occupational therapist who graduated from the University of Toronto in 2002. Tess started her career working in the private sector and community settings. She then joined the Toronto Rehab UHN team at the Linter site for spinal cord injury rehab program in 2008, working as an occupational therapist. Since then, Tess has had several opportunities to diversify her skills and receive awards while fulfilling the following roles at UHN, which were Lean Process Improvement Lead, Special Projects Manager, Patient and Family Educator, as well as Manager of Outpatient Services in Neuro Rehab. Tess is currently working in a clinical role at the Geriatric Day Hospital program. And Deborah McGravy graduated from St. Francis Xavier and completed an internship to become a registered dietitian. She has worked in many clinical areas such as neurology, neurosurgery, renal surgery, epilepsy, and for the last 20 years has been in critical care at Toronto Western Hospital. She has presented on numerous occasions at the UHN wound care workshops. She is passionate about educating patients and families on how to prevent and take care of their pressure injuries. And she obtained her Master's of Arts in Adult Education at Athabasca University in 2023. So we have a very knowledgeable and expert group of speakers with us today on this topic. And today they will talk about a patient's story with pressure injury, understanding what pressure injuries are, which are also known as bed sores or pressure ulcers, information on how to care for and support patients with these wounds, and understanding the importance of food and the ability to move in pressure injury prevention and healing. So with that, I would like to now turn it over to Chris to share his story as a patient with us today. Over to you, Chris.
Thank you, Alina. Hello, everyone. My name is Chris Stigas, and I've been a patient partner with UHN since 2017. In 2014, I had a spinal cord injury. I fell in my shower and was lying in the shower approximately 14 to 15 hours before somebody found me. Prior to that, I was a commercial and industrial electrician. After my accident, or because of my accident, I had the experience of going through pretty much the whole healthcare system, right from the emergency 911 phone call to emergency surgery to ICU, inpatient rehab, co-op housing, outpatient, and eventually being back in the community in an assistive living building. Shortly after being released from Lyndhurst, one of my care workers noticed that I had a small mark underneath my left bum cheek. We didn't really think much of it, and I was simply told to monitor it, and it was the beginning of a pressure sore and a light dressing, and to stay off it would be the treatment moving forward. My wound started off very small, and because I was told that I had very healthy skin and because of my age, I really didn't think anything of the fact that I had a small mark on me. The recommendations were to monitor it, and this was something that should go away if I stayed off it and I was on top of it. I didn't realize how quickly things could turn around and spiral out of control. My 0.4 centimeter wound slowly started to increase to 1.5 centimeters, 4 centimeters, and eventually got to be 9 centimeters. 9 centimeters is approximately the size of a Q-tip. It got so deep that my bone got infected, which then required me to be admitted into the hospital for antibiotics that needed to be given to me intravenously. They required the thicker blood vessels quicker to the heart, and it took over a period of 2 weeks, it took 3 different tries to get the antibiotic and the PICC line into me. This antibiotic also required that I go for blood tests twice a week in order to prevent kidney failure. And after 8 days of being on these antibiotics, that's exactly what happened. I was called back into the emergency room and was told that my kidneys are failing, and if they didn't come back online, that it could be fatal. And my world at that point was completely, even more so than my accident, turned upside down. How could a little mark on my skin from something that required a light dressing and monitoring have all of a sudden turned into something that is threatening my life? I wish that I would have listened more and not had such a false sense of security, knowing that I had healthy skin or thick skin in the beginning, by something that could have been so easily preventable. This whole process took approximately 10 months of my life. There were endless nights of not being able to sleep well because I needed to spend 2 hours on one side, then be turned on my back, 2 hours on my back, 2 hours on my other side. And it really disrupted my life. It put me into a sense of depression. I couldn't go outside. I missed the whole summer. And as I mentioned, almost ended my life from something that started off from just a little mark. It also required me to go through x-rays, angiograms, CAT scans, lab work, dressings, antibiotics, both orally, intravenously, and the costs to the healthcare system are, I'm sure, were astronomical. The costs to myself were anxiety, stress, not knowing what was going on, not knowing how to get this better, monetary by cab rides and getting back and forth for my appointments, and again, the quality of life over the 10 years. Moving forward from this, I now realize how important it is in the early days of injury for patients to really understand it's almost not if you'll get a pressure sore, but when you'll get a pressure sore. And what you thought was your health level previous your accident is not what it is after your accident. Your skin, being your biggest organ, should be the biggest focus of your time and integrated into your daily schedule. Same as brushing your teeth, same as washing your face, should be regular skin checks. It's something fairly easy to spot and very preventable, and something that once this process starts, it's really hard to turn around. And as I said, took 10 months out of my life. So always check your skin. It's your biggest organ. It's something that's extremely easy to prevent and could mean the difference of having a quality of life that you enjoy every day, or being in bed on your side for 10 months or more. I hope my message has some value to future and patients who are currently in the healthcare system, and always check your skin.
Thank you, Chris. I definitely think your message and your story has tons of value and a lot to learn about from everything you've gone through. So thank you truly for sharing your story with us. There's so much to learn from what you had to go through.
Thank you.
Next up, I will pass it over to Catherine and Joshua to take us to the next step of the session. Over to you.
Hello, everyone. Thank you for taking the time to be part of this important presentation. Skin injuries fall into different groups for healthcare workers. They can result from mechanical forces like pressure, friction, and shear. They can result from thermal or disease-related causes. Some examples of skin injuries include burns, malignant wounds, diabetic foot ulcers, skin tears, and trauma, among others. It's our goal today to share information about pressure injuries. Whether you are a caregiver or someone who has or is at risk of developing a pressure injury, as experienced wound care nurses, we have seen the pain and suffering that these wounds can cause. We also understand the quality of life that changes when someone develops a pressure injury. Next slide, please. Healthy, intact skin has many important functions. Our skin is our largest organ in our bodies. Keeping it clean and dry and properly moisturized helps to keep it free from injury. Nutrition and hydration play an important part of this. As we age, skin changes occur. It thins out, cells produce less oil, so it tends to be drier. The skin loses strength and elasticity over time as we age. These are important factors that can increase one's risk. So, what is a pressure injury? A pressure injury is also known as a bed sore or pressure ulcer. It's a localized damage that occurs to the skin and underlying tissue from persistent unrelieved pressure. They usually occur in an area over bony prominence, such as the tailbone or the heels. Pressure injuries are typically staged based on the degree of damage that is done to the skin and underlying tissue. They can be superficial or can go deeper to the muscle and bone. Medical devices like oxygen tubing or IV tubing that come in contact with the skin can also cause a pressure injury if they're secured too tightly. Therefore, it's really important to regularly inspect the skin under these devices to check for evidence of pressure. Devices should be repositioned regularly when possible. Pressure injuries tend to occur more commonly in people who are unable to move independently or rely on others for assistance with activity of their daily living. Skin tone will affect the appearance of a pressure injury. For example, a stage 1 pressure injury will appear as a reddened area that does not go away on a person with light colored skin. This is not so easy to detect on darker skin tones. The term offloading is used to discuss techniques that are intended to relieve the pressure, to promote good circulation to the areas of risk. When you see an area of redness then, on a sacrum, for example, turning to a sideline position will relieve the pressure on the sacrum. Reassess the skin in 10 minutes afterwards to see if the redness remains. If so, you are seeing a stage 1 pressure injury. For heels, supporting the lower legs with pillows so the heels are raised off the bed surface takes the pressure off the heels. This is called floating the heels. These are important prevention practices that help to reduce the risk of pressure injury development. Tissue tolerance for both pressure and shear forces is lowered when other risk factors are present. Examples of these are outlined in the wheel in this picture. When we plan to care for someone who has any or all of these risk factors, we focus on relieving the pressure and reaching out to our team members to help us manage the other risks. Both prevention and care for patients who have a pressure injury requires teamwork. The interdisciplinary team may include a physician, a nurse, a dietitian, a physiotherapist, or an occupational therapist. And especially important is the hands-on caregivers. The patient and family are always at the center of our team. We need to manage moisture to keep the skin clean and dry, moisturized. Barrier creams are available for those with urinary and fecal incontinence. Nutrition, our dietitian today will discuss in more detail. But if your family member needs it, or the person you're caring for needs it, assist with feeding, provide protein-dense supplements, keep a record of how much is being eaten. Repositioning and turning helps to prevent the skin breakdown under pressure. Using safe handling techniques to avoid friction injuries and skin tears, as well as a caregiver injury. It is important to recognize that not all pressure injuries are preventable. It is also important to recognize that not all pressure injuries are healable. The skin is a reflection of what is going on inside the body. At life's end, the dying can experience something called skin failure, which is a non-reversible form of skin injury. When skin and soft tissue are pressed between bony structures and hard surfaces outside of the body, small blood vessels get squeezed off. Blood carrying oxygen and nutrients to the skin cannot get through, and the skin will eventually die. The longer the pressure goes unrelieved, the more damage is done. This can happen within 2 hours, even less time when someone has other health problems. Areas at risk are those that lie over bony prominences, as highlighted in the images we see here. A key prevention strategy is to have a turning and repositioning schedule that helps to offload the pressure on a regular basis. As noted before, medical devices can be a source of pressure and should be inspected regularly for any signs of potential breakdown. Shearing is another factor that contributes to pressure injury development. This occurs when an individual is sitting in an upright position, as shown in the image, where the body slides down the bed while the skin is held fast on the surface. This creates stress on tissues between the bone and muscle, with the pull of opposing forces. When to ask for help. Consider keeping a photo record of the wounds. Pictures are a good reference for when you may be concerned that the wound is deteriorating, or if you want to see the improvement that you're making. Please get consent to share any personal health information. Wound care goals should be based on what the wound looks like. For example, if there's too much drainage, moisture management is an important factor. If there are signs and symptoms of infection, dressings that provide antibacterial coverage can manage the bacteria. Sometimes, based on wound healing factors, a wound might be considered maintenance. This means that the underlying health issues are preventing the wound from healing. Take time to reflect. Was there any event or disruption in the turning schedule? Contamination from urine or feces? Has there been a change in eating or moisture management? Was there a fall? When you contact your care provider, be prepared with some information about what might have led to the deterioration. Remember, we treat the cause, change the plans to address the contributing factors, and reduce risk of further injury. Keeping records in a notebook helps to organize the details of care and any related concerns. If the wound becomes bigger with more drainage, redness, and pain, please call your primary care provider to reassess. Now I'll hand over to Josh.
Thanks, Kathy. So this slide shows the importance of understanding the whole needs of a person with a wound like a pressure injury. If you can see from the illustration, we always want to start at addressing the primary cause of the wound, such as relieving pressure and taking away the shear for someone with a pressure injury. Without treating the cause, no matter how advanced our wound care approaches may be, this will not be effective. We also want to address the concerns of the person and their families, such as their pain experience or any questions about their current treatment, to ensure that the person and the team understands and agrees with the current plan of care. The ability of the wound to heal is also important, which considers the person's circulation or blood supply, particularly in wounds that may be located on the heels or feet, the person's current nutrition, and other health conditions that the person may present, which can prevent or impair the wound's ability to heal. Once we treat the cause, address the concerns of the person and family, and determine the wound's ability to heal, clinicians will then assess the wound and develop a plan of care that will either promote wound healing or prevent it from getting worse. Next slide, please. So what can healthcare professionals do? One of the important themes in our discussion today is the value of building partnerships between healthcare professionals and their patients or persons with pressure injuries. Patients and families may have concerns or questions about their plan of care. Therefore, building communication tools such as a turning schedule may help address some of these concerns. As healthcare professionals, we also want to ensure we provide recommendations based on the current body of evidence, but should be tailored to the needs of the patient and family. Lastly, a focus on prevention is of primary importance. The pressure injury plan developed should be reinforced to all members of the healthcare team, including the patient. As pressure injury prevention is 24/7, we have to ensure that any potential risks identified should be addressed by the plan of care, such as keeping the skin clean, dry, and protected when incontinence is a concern, or the use of an appropriate pressure redistribution surface for the bed or chair, and also ensuring that the patient receives adequate nutrition and hydration. Next slide, please. It is important to understand that sometimes, despite our joint efforts to prevent pressure injuries, unfortunately, not all pressure injuries are preventable. And I would like to repeat that again, that not all pressure injuries are preventable. And this is because of the person's complex health conditions that may be present. Therefore, please get help from a professional to assess and monitor the wound, to provide education to family or other supports available, to order any advanced wound care products and supplies as needed, to assess the need for or change in the current pressure redistribution surface, and lastly, to develop a plan of care. It is also important to highlight that pressure injury prevention and management requires a team approach. As nurse clinicians, we also work closely with other members of the team, such as the registered dietitians, to support the patient with nutritional counseling, assessment, and care planning to promote wound healing, and also with our registered physiotherapists and occupational therapists in promoting safe mobility, offloading, and appropriate positioning. Now, I would like to pass it to my occupational therapist colleague, Tess, to talk more about her perspectives in pressure injury prevention and management. Over to you, Tess.
Thank you, Joshua. I'm going to be speaking to you from a therapist perspective and hopefully being able to share some functional tips that you will be able to learn and have in your daily lives and be able to practice. Next slide, please. So my colleagues have already spoke a lot about the importance of relieving pressure, and I'm going to speak to you a little bit about more in depth. Shifting your weight every 15 minutes is the gold standard for pressure relieving. And this pressure relief moment, as we call it, should last between 1 to 2 minutes. Again, this is our gold standard. We recognize that this may not be possible all the time. However, it is something to keep in mind. Some people also like to, if they do have a lot of skin issues, they do like to set alarms to remind themselves to change their position every 15 minutes or so. And this strategy has worked for a lot of people. And what do I mean by changing positions? I mean leaning forward, maybe on a desk, on a table, or leaning side to side, being able to relieve pressure from one point of the body. And my colleague spoke about some bony prominences that we had talked about earlier, such as maybe heels or bum bones or hip bones. And this is why it's so important to pressure relieve, especially while we're sitting. Another option to pressure relieve, if you're able, is to stand. And that will take some pressure off certain joints and certain bones. Keeping your hands and arms on soft surfaces while you're pressure relieving is very important to consider. The reason to consider this is because if you leave your arms and hands on a hard surface while you're pressure relieving, this can then in turn cause some other injuries to those parts of the body. And more specifically, if you're putting too much pressure on your wrists, for example, that can potentially lead to other medical issues such as carpal tunnel syndrome. So really understanding where your body is at and how you're positioning yourself is very important. Next slide, please. If you require the use of a wheelchair, a therapist may be able to help you figure out the best type of seating component that you can use for while you're sitting in your chair. And while sitting in your chair, you will also have to really follow those recommendations of pressure relieving that we just talked about in the previous slide. It is very important to do so. And again, I will remind you, it's important to pressure relieve every 15 minutes and try to hold that position off of your joints for 1 to 2 minutes each. We may move around naturally, and this is our form of pressure relieving. But if you are able to remember to do that, that's great. But if not, again, setting that alarm really helps. If you can see, you'll see at the bottom of the right-hand side of your screen, there's a picture of what looks like air bubbles. So this is actually an example of an air cushion that we do recommend some of our patients use. This is filled with air, and it really helps to take away some of the pressures while we're sitting, especially while using your wheelchair. So again, it's important to reach out to your healthcare professionals to ensure you have the right surfaces to sit on and that are going to be best for your skin health moving forward. Next slide. So another area where we have to talk about pressure relieving, and Chris mentioned this as well, while in a sleeping lying down position, it is important to really understand where pressure points are happening. So, and again, naturally, sometimes we move around in the middle of the night. And so we're changing positions without even realizing. But if you're unable to do that on your own and you need extra help, it is super important to remember to try to change your position so that you can relieve the pressure off of those very sensitive pressure points, including hips, heels, the bum area, and the lower back. Some people like to use pillows and place pillows in between their knees. Some people like to use a pillow while they're sleeping on their back and place the pillow underneath their knees. And again, everyone has different needs. So please reach out to your healthcare provider and discuss your specific areas of need, as they may have different recommendations for you. Keep in mind, these are just general principles that we like to share with people. And if you do require help with turning, as Chris mentioned, he had to turn every 2 hours. Again, that is the gold standard in the repositioning your body, would be every 2 to 3 hours. And this is especially important if you have skin health issues that include numbness. So if you're unable to feel certain parts of your body, or if your skin is very fragile. So again, turning at least 1 time per night is essential, especially for those that have skin issues. And if not, then naturally turning the body may happen, or really being engaged in turning every 2 to 3 hours. Next slide. Some other tips in terms of keeping pressure off your skin include avoid using clothing items that have thick seams or buttons. And this is very important because these types of clothing can actually press against your skin. And if it's pressing against your skin for an extended period of time, this can actually cause some skin injuries. Another piece of item for dressing to consider is wearing shoes, types of shoes that you wear. Trying not to tie your laces too tight, for example. If the laces are tied too tight and you may have some issues with bulging and pressure on certain areas of the foot, that might lead to some other skin injuries. And just to note, if you do have neuropathy, or if your doctor has spoken to you about that type of diagnosis, you must check your feet every single day to ensure that there is no extensive swelling or discoloration in the skin. So my colleagues prior to me talked about reducing shearing, reducing friction and rubbing. So this is very important when considering what we call transferring either from a seated to a standing position or from a lying down position to a seated position. These are all very important things to consider and what your body's doing while you're doing a transfer. So I'm going to go into a little bit more detail from a therapy perspective about different types of equipment that may help you to prevent this, what we call shearing, friction, or rubbing of the skin. And this is very important because your skin, again, may be very fragile, or you may not be able to feel certain parts of your body. And so it is very important to understand the options that are available to you. Next slide, please. Let's start with transferring on and off a chair. So in order to be able to move from the back of a chair into the front, if possible, it'd be really great to create some space between your bum and the chair. This will help reduce friction or shearing. And it's best to sit in chairs that have armrests on them. This will allow you to push up against the armrest in order to create that space so that you can move your bum towards the closer part of the chair. Then you can lean forward and push yourself up without having to shear or cause any friction or rubbing of your skin on surfaces. Another thing to talk about the importance is trying to get from the bed to either a wheelchair or from the bed to a standing position. And a lot of people have tried using what we call a transfer surface, a transfer board. And as you can see in this slide, this creates the ability to transfer from bed to wheelchair or wheelchair back to your bed using a smooth surface. And this will also allow this client that you see in the picture to not get caught in any piece of the wheelchair along the way. If your clothing or your skin gets caught on any type of surface, that can cause major damage. So again, just another option to think about and talk to your healthcare professional about, as this might be an option for you. Keep in mind that there are other factors that can really have an impact on your skin, like age, other health conditions, and medication side effects can also impact your skin. It is very important to talk to your healthcare provider about certain medications that you are on and if they have any impact on the fragility of your skin. This is a very important topic to cover with your physician or pharmacist. Next slide. So here are some examples of other types of equipment that may help with reducing the shearing, friction, or rubbing of skin on surfaces. To the left of your screen, you will see somebody holding on what we call a Saskapole. Now, this will allow this person to stand from a seated position off of her bed with minimizing the amount of shearing and friction that's happening, because she will be able to use her arm strength to help pull her up and not try to keep sliding to the edge of the bed. That's one option. Another option on the right-hand side talks about how the bed rail that goes in between a mattress and the box spring of your bed, and you can use this to help put yourself up from a seated to a standing position. And again, these are general recommendations, but please speak to your healthcare provider about what will work for you and your specific conditions. Next slide. Here we go. There's some other options for you to consider. So these are used for in the bathroom setting. So as you can see, there's something called a raised toilet seat. This will allow you to use your hands to go from a seated to a standing position, or from the standing to the seated position, while reducing the shearing involved, or the friction or the rubbing of your skin. Another example that you'll see is it's called a toilet safety frame. So again, this allows you to push off of the frame to be able to stand and sit while reducing the shearing and rubbing and friction of the skin on the surfaces. Now, this option might be better for those of us that are shorter, because it will decrease the height that you have to try to sit and stand from. Another option is called a bathtub clamp. This will help you get in and out of the tub safely and without having to sit on the edge of the tub. I've had some patients tell me that they have sat down on the edge of the tub and then swung their feet over. So this would definitely be a better option for you, because that will reduce the risk of any skin injuries on the bum area. Another piece of equipment is called a padded transfer bath bench. This piece of equipment allows you to sit on the edge of the bench and swing your legs in, and it's padded because it'll protect your skin a little bit better while transferring on and off. Again, very important to speak to your healthcare provider for your specific needs and what will work for you. So in general, it is very important to move your body and eat well. And in order to move your body, this also includes avoiding sitting on hard surfaces for a long period of time. So planning small shifts in position for all of us every 15 to 30 minutes, as mentioned before, is very important. And again, changing positions, leaning forward, going side to side, and if you're able, to stand from a seated position. All of these techniques are very good in reducing the risk of skin injuries. Also, from a therapy perspective, consider doing these activities while you're participating in things you enjoy, like watching TV or reading perhaps, or maybe being online while watching this. It's a good idea to continue to change your body position. It is very important to consider to reduce the risk of injury to your skin. And another point to consider is travel. So a lot of us like to travel, and it is important to keep these principles in mind while you're traveling, either in a car, on a bus, on a train, and definitely on an airplane. So please do keep these things in mind while traveling as well. Skin health is very important. Also, and it's been talked about before, is eating a well-balanced diet and drinking plenty of fluids does definitely have an impact on your skin. And now my colleague Deborah will talk to you more about that.
Hello, it is a pleasure to be here today to speak to you about the power of nutrition in wound healing. Nutrition plays a very important role in preventing and healing pressure injuries. Pressure injuries affect the quality of one's life. An individual is not able to do everything. They may be limited in activity and/or they may experience pain, as we heard from our speaker today, Chris. Next slide, please. What is malnutrition? So we're going to learn about what good nutrition is, but we also have to understand what malnutrition is. Malnutrition can be too little or too much of the calories, protein, fluid, and the micronutrients that we may eat, such as our vitamins and minerals. That can be the result if we're getting too little or too much. It can contribute to nutrient deficiencies, which can lead to health issues. Next slide, please. In talking about this, we're going to talk about some of the factors of what would contribute to malnutrition. Some people, when they're in pain, or if they've been through a lot, maybe they're not feeling well, they may have no interest in eating. They lack an appetite. They have no desire to eat their 3 meals a day, which are so important. They have no energy to make their food, and they just don't have any hunger. So they have to make themselves eat, which is really hard. They just have no appetite, and that can lead to malnutrition. Some people, if they've lost weight or gained weight, they may have had other medical conditions. They may have issues or difficulty chewing their food. They may have swallowing issues. They may pocket their food. They may not be able to swallow things as well as what they may have. And this can affect their nutritional intake. Some people may be missing teeth or dentures that don't fit because they lost weight or gained weight. And if our dentures or our teeth, they affect the way that we chew our food. They affect our food choices, and food is a pleasure for everyone. Some people may have health conditions such as diabetes, heart, or kidney problems. They may have to avoid certain foods. They may have to eat certain foods, and this may be difficult for them because they're missing their favorite foods. Some people, because of health conditions, they may need someone to help them eat, or maybe they need certain utensils to make eating easier. If you're requiring someone to help feed you, this takes time. The individual worries about the time that this takes, and overall, this affects the overall nutrition that they're taking in. All of these factors can contribute to malnutrition. Next slide, please. In the next few slides, I'm going to talk about energy, protein, fluid, and the micronutrients, vitamins and minerals, the key ones. We're going to learn about some of the important things that we can do to help take care of pressure injury and/or prevent a pressure injury if we can. Next slide, please. Protein. Protein are the small building blocks called amino acids. Your body uses these amino acids to build and repair muscles and tissues. Protein is very important and required for healing, as protein repairs the pressure injury cells. Where do we find protein? We can find it in meat, such as beef, pork, lamb. We can find it in fish, such as salmon, haddock, sole, cod, tuna, salmon, eggs, dairy products like our milk, yogurt, ice cream, cheese, legumes, our lentils and our beans like kidney beans and chickpeas are very important, good sources of protein, and seeds, peanut butter, walnuts, pumpkin seeds, pistachio, nuts are very important, and they're all proteins that we need to eat to meet our needs for healing. How much protein do you need? Well, adults need 0.8 to 1 gram per kilogram of body weight per day. What does that mean? It means about a deck of cards, which is about 3 ounces. So we need 3 ounces at lunch and about 3 ounces at dinner, 1 ounce at breakfast, which would be a third of a deck of cards. Adults with a pressure injury have an increased need. They need 1 to 1.5 per kilogram. That is a lot of extra deck of cards. So we need to get, how are we going to get that? If it's already difficult sometimes to eat those 3 ounces at lunch and dinner, snacks. So you need to have snacks in between meals to help get the protein needs that you need and to meet that extra need for the healing. Next slide, please. Carbohydrates. Carbohydrates control our metabolism. So what is metabolism? Metabolism is a process that our body goes through when it's taking protein and carbohydrates, which are so essential for healing, So it's helping them to break down so that we can absorb the key nutrients to help with healing. Carbohydrates provide color to our food. They help give it flavor and different options for eating, for variety. So our different varieties that we may have, for examples, are bread, cereal, pasta, rice, potatoes, and vegetables like broccoli, cauliflower, spinach are very important to have. Next slide, please. Fats. Fats provide the insulation. We need a certain amount of fat. The insulation is around our organs in our body. Fat releases energy to support the healing process in wounds. It carries the fat-soluble vitamins, vitamins A, D, E, and K. Where do we get fats? What types of foods? Our vegetable oils, sunflower oil, safflower oil, olive oil, and or avocado oils. Also our margarines, our butters. A lot of margarines today come and they're made with plant-based fats like our sunflower oil or avocado oil base. So fats play a very important role as well in healing wounds. Next slide, please. Fluids. And our speakers today have spoken about the role of fluids and how important they are. Fluids are very important. Fluids such as water, milk, juice help support the blood flow to the tissues, and they prevent additional breakdown of the skin. We need to remember that some people have wounds that are losing fluid every day. They have drains. Some people may have a fever. Your body is losing fluid that way. So we need to replace the fluids that we need to help keep our body well hydrated. It's hard sometimes to drink enough water that we need, and most of us need about 6 to 8 cups of water a day of fluid. So having a glass of water or milk or juice at our meals is important. And also getting water in between meals is very important. Next slide, please. Vitamin C and zinc are vitamins and our mineral. I'm going to talk about vitamin C as our key vitamin and zinc as a key mineral. Vitamin C helps to correct the skin. It improves the strength and the integrity of the skin. It aids in iron absorption. Interesting, drinking orange juice or apple juice, which contains vitamin C, helps the whole wheat bread or the cereal that you may have at breakfast. It helps the iron from the bread or toast or cereal to be absorbed. So these two are working together. It's really important to have vitamin C foods every day, such as citrus fruit and juices, tomatoes, berries, potatoes, and broccoli. It's very important because we need to take in vitamin C foods every day. Zinc plays a key role as well. It works with protein to be used in the body. It helps vitamin A to be used in the body as well. So it's doing a dual factor. Some of the sources that we get zinc from are meat. So our beef, lamb, pork, liver, eggs, and seafood are very important, and we get zinc from them. Zinc helps the cell growth, which is part of the healing process for pressure injuries. Next slide, please. So what can we do now that we know about carbohydrates, protein, fat? We know about fluids and vitamin C and zinc. What can we do? How do we do that? We eat 3 meals a day and snacks in between meals. Breakfast, snack, lunch, snack, dinner, snack. If you're not a breakfast eater, it can be difficult. Sometimes when I'm doing diet histories with clients, I'll ask, what is the first thing that you have to eat during the day? Some people are just not breakfast eaters. They can't eat. The important thing is just to have something. We need to eat every 2 to 3 hours during our waking hours to help give us the protein and the carbohydrates and the fat that we need to help heal a pressure injury. It's really important to have protein at each of these meals to help get the right amount of protein that we need and the increased amount that we need to help with the healing process. Drink water or milk or juice or tea. It is really very beneficial. Sometimes we can't get enough protein powder and we have to rely on supplements. So we can try to add protein powder to our foods to meet our protein needs. We can purchase protein powder from a health food store or the grocery store, pharmacy. We can add it to our soup, our milk, or our juice. We can add it to some of our casseroles that we have. So we can put that protein in there, eat the same quantity of food, but get the extra protein that we need. Also interesting, We can also try supplements. Most of you have seen commercials or heard about Ensure or Boost, or we can have a store brand from the various stores. A supplement with high protein can be very beneficial. An interesting study that I read recently talked about how a person with a pressure injury, they took a supplement on top of eating 3 meals a day and snacks. They took this supplement 2 a day, and it made such a difference in 8 weeks that their pressure injury healed. So just 8 weeks of taking this supplement made a big difference. So two drinks of 250 mils can make a big difference in helping this to heal, because it can be a lot of work to eat extra protein and eat extra when you're in pain and you're trying to shift and do all of the other things that our colleagues are suggesting that is so, so helpful in helping our healing stage. Thank you. If there's any questions, please send them in. It has been a pleasure to speak to you today about protein healing for pressure injuries. Thank you.
So where to go for more information? Well, the next set of slides are some examples of available resources. Links to these websites and resources will be included in the description box below. Next slide, please. Wounds Canada is a charitable organization dedicated to the advancement of wound prevention and management. They have a dedicated section for patients and caregivers, which has a series of resources, including the Skin Bundle on pressure injury prevention, which highlights the importance of skin inspection, use of appropriate surfaces, need to keep moving, the management of incontinence and moisture, and as discussed by Deborah and my colleagues, the importance of nutrition and hydration. Next slide, please. Here are some patient education brochures available online at UHN. Also, be aware that your local hospitals and community care providers may also have their own patient family education resources. So please feel free to ask if available. The Canadian Pressure Injury Advisory Panel is an professional collaboration panel dedicated to improving the lives of persons affected by pressure injuries across the continuum of care. Currently, one of the working groups within the panel is working on creating a hub or central location for patient family resources on pressure injury prevention and management across Canada. Next slide, please. Food is medicine and food can heal wounds. Dietitians of Canada is a great resource for meal planning and to look for different ideas and recipes. And as noted, their links is actually on this slide. Next slide, please. And last, but definitely not the least, you're always welcome to contact the Patient and Family Learning Centers at UHN. They offer reliable and up-to-date health information to patients, families, healthcare providers, and members of the public. All of their services are free and available in multiple languages. You can always call, email, or visit their centers Monday to Friday between 9 a.m. to 4 p.m. Now over to Alina with her final reminders to bring this informative session to a close.
Thank you. So I'd like to take a moment on behalf of the patient education and engagement team to thank all of our expert speakers today, Chris, Catherine, Joshua, Tess, and Deborah, for sharing your valuable knowledge and expertise during this session. It's sure to help a lot of people watching. And for those watching, your feedback is very important to us. You can go to the link on your screen or in the description box below to complete the survey at the end of this video. The link is also available down below. And we thank you in advance because your feedback helps us to know what you liked, what we can improve on, and what topics you would like to see in the future. And to keep up to date with our health talks or any current events at UHN, you can subscribe to our online patient e-newsletter to get up-to-date information on events and resources. And finally, we hope to see you at our next session in June on the topic of stroke, risk factors, and strategies for prevention. Thanks for watching.